So, today I am going to be doing my presentation on bipolar disorder. This is a disorder I chose to talk about, so I will go ahead and get started. So these are just going to be some of your regular symptoms for someone suffering from bipolar disorder. There actually are a lot of symptoms and they can go hand in hand with other disorders as well, but these are the five that I researched and found that are very prevalent to bipolar disorder and only bipolar disorder. So we have impulsive behavior, extreme mood swings, which can go hand in hand because, of course, you can have extreme highs, extreme lows with bipolar disorder, and that kind of goes into the impulsive behavior and the actions you take because of the mood swings. And after that, we have lacking energy, a loss of interest in everyday activities, and difficulty sleeping. And again, these will also go hand in hand because, like I said before, you can lack energy, like the other two went with each other. You're lacking energy just because of this mental disorder. And of course, that can cause a loss of interest in everyday activities, but sometimes you just have one or two of these symptoms. But a lot of times, just one of them can cause the other symptoms, like difficulty sleeping. So you have problems sleeping, so you're more tired of the day, so you're lacking energy. So these symptoms can very much go hand in hand, but these are some of the top symptoms for bipolar disorder. So we're going to talk about impulsive behavior. I'm going to close this out. Okay. We're going to talk about impulsive behavior. So impulsive behavior, it's typical expressions of impulsivity in individuals with the disorder includes substance abuse, spending sprees, gambling, reckless driving, risky sexual behavior, sudden relationship breakups, and non-suicidal self-injury. So this is one of the main symptoms of bipolar disorder. When they have the extreme highs, this is where the impulsive behavior comes in, and the substance abuse can have a really, really strong effect on the disorder. Again, all of it, the spending sprees, the gambling, they when they get in this mania, which is their extreme high, they tend to do these things and they'll forget about them. Which it seems crazy when you don't have that experience and you don't know how it feels. So yes, so the spending sprees, the gambling, the reckless driving, the sexual abuse, these are all things they do in that extreme high, that mania phase. People with this disorder thrive on attention and excitement, and they often get themselves into trouble after acting first and thinking later. So, like I said before, with this behavior, they don't even think, they just do. They do because they want that attention. They're feeling that mania and they just go, go, go. And they don't think until afterwards. And most of the time, they forget that what the thing they did, they completely forget about it. And then they have to face the consequences afterwards. So, extreme mood swings and lacking energy, I'm going to be talking a little bit about that. So those who struggle with the bipolar disorder, I wrote borderline personality disorder and I meant bipolar. They find their moods rocketing to extremes over moments as small as these and experiences reality all day, every day. So they have extreme mood swings and lacking energy. So they experience these every single day. It's not just like sometimes we'll have a bad day, sometimes we'll have really bad mood swings. And that's not every day. That's not very common to have it every single day. So people with bipolar disorder, they do face this every single day, sadly, and that's just their reality. Sleep problems, again, like I said, are a common symptom for people with bipolar disorder, not borderline personality disorder. Please excuse that. Symptoms include insomnia, excessive sleepiness and fatigue, vivid and distressing dreams. So again, that goes with the lacking energy and the extreme mood swings in a way because those can very tire you out, especially with bipolar disorder. So now I'm going to talk about bipolar 1 disorder. So there's a bipolar 1 and a bipolar 2. I'm going to explain the differences and just how the compare and contrast between the two. So bipolar 1 disorder, it's defined by manic episodes, like I talked about before, that last for at least 7 days, nearly every day for most of the day, or by manic symptoms that are so severe that the person needs immediate medical care. So this one's going to be the more serious one of the two. Usually depressive episodes occur as well, typically lasting at least 2 weeks. So these are for people that, like I said before, the mania where they have shopping sprees, the non-suicidal injuries, or just breakups or gambling, all of that. Those will they will last up to at least 7 days. That will be people with bipolar one disorder. So this is going to be the more extreme one. Um, Usually that's what the bipolar one main difference is. Like bipolar one and bipolar two, the main difference is that the mania that they experience is very, very severe, and it's it's just very dangerous and it causes issues. So that's bipolar one disorder. And now we're going to talk about bipolar two disorder. I'm going to come over here. So this one's it's still around the same, just not as extreme as bipolar one. So people with bipolar 2 experience hypomanic episodes, which still include out of character behavior, but aren't as extreme as those with bipolar 1, like I said. It involves at least one depressive episode lasting at least 2 weeks and at least one hypomanic episode lasting at least 4 days. The depressive symptoms include sadness or hopelessness. Hypomanic symptoms include a persistently elevated or irritable mood. So the people with bipolar 2, they're going to be more sad. They're going to kind of be the low, and the bipolar one will be more of the high, which of course they still have the same symptoms, but the bipolar one is definitely the more extreme. So now we're going to talk about treatment. Treatment is usually lifelong and often involves a combination of medications and psychotherapy. So these are the four. There's obviously other types of treatment you can do, not just for bipolar disorder, but any disorder, mental illness. It's therapy obviously helps with any mental illness, anything going on inside mentally. So therapy, of course, is just you should do it even if you feel like you're not struggling with a mental illness. But therapy is known to help with bipolar disorder, at least give them a little more, little less stress, not more stress. That would be good. It takes away their stress. Therapy really helps them, feels like they have someone that can understand them. Um, Mood stabilizers and antipsychotics, I'm going to talk about that a little more, but those are going to be the medication of the treatment. So we have like the therapy and meditation. There's also the medications you can take, which are going to be your mood stabilizers and antipsychotics. And I'll be talking a little bit more about that in just a second on another slide. And then meditation, of course, which can go along with therapy, because meditation is a form of therapy in a way. The meditation has been known to actually help people with bipolar disorder, just because, again, they have so much stress and a lot going on in their life. So, of course, that will calm them down a little more. And again, I will talk about this on the other slide. So let's go ahead. All right, so we're going to start with therapy and meditation. So, of course, meditation cannot replace traditional therapy for bipolar disorder. So it's definitely best to check with a doctor about other treatments that are needed, such as medication or psychotherapy. And even though it's not a cure for bipolar disorder, meditation has been known, like I said, to help you relax and reduce stress. So again, people with bipolar disorder are going through a lot of stress in their life. So meditation is something they have found to at least reduce it a little bit in their life. Cognitive behavioral therapy is going to be the type of therapy that works best with people with bipolar. It involves trying to change your patterns of thinking. It's effective for bipolar disorder. And this is according to the American Psychological Association. So that is going to be the best fit for therapy with someone who suffers from bipolar. Okay, now we're going to talk about mood stabilizers and antipsychotics. So lamotrigine, which is also called Lamictal, I may be pronouncing this a little incorrectly, but those are going to be your mood stabilizers. That's probably going to be the most effective one for people who are suffering with bipolar disorder. It's more for the depression in bipolar disorder and not as helpful for the mania side. And we're going to get into that a little more. The starting dose of it should be very low and then just increase in time. The American Psychological Association suggested that over 4 weeks or more, it should be increased. And because mood stabilizers can be so slow, like the one I mentioned, doctors may also prescribe the quick acting antipsychotics along with the mood stabilizers, which is for the bipolar disorder. And that is going to be more for the mania. It is for the mania or the depression. And like I said, they can work on both for relief within hours. But it is okay for them to be on mood stabilizers and antipsychotics. And the antipsychotics will help with the mania a little bit. So you will see that more in bipolar 1 people because their mania gets very, very extreme. Okay, so this is just a quick summary of the bipolar disorder. It's a common psychiatric disorder. It's characterized by affective instability and cognitive deficits. I really can't talk today, guys. Particularly during mood episodes. It's very important to be knowledgeable about treatment and to not self-diagnose before going to a doctor because, again, it's a real disorder, and the medication it's something people suffer with a lot and go through a lot of stress, and the medication can be very rough on people. So it's very important to be knowledgeable about all the treatment and to not self-diagnose. And these are my sources. We have the National Health Service, the National Institute of Mental Health, Substance Abuse and Mental Health Administration over here. And we have the What Are Bipolar Disorders, psychiatry.org, and then Medline Plus for bipolar disorder. Thank you so much.